Motivational interviewing is a person-centered approach to resolve any ambivalence about changing behavior in a client. It starts with the phases of change, the client's awareness to the situation, and the spirit of motivational interviewing. Motivational interviewing is demonstrated as part of 4 components. There is partnership, acceptance, compassion, and evocation. This is all linked to Carl Rogers' idea of collaboration and the humanistic approach to having a relationship between the client and the practitioner. This is done through being non-judgmental, empathetic, and really hearing the client's story as part of supporting their autonomy in the relationship. This can drive self-motivation to move on to different stages in the stages of change model. It can provoke the resolution of ambivalence for the client, where the trans-theoretical model really dignifies the change process in the individuals. The pre-contemplative stage of change, which is the first stage, this is where the client's really not ready to move on to any sort of change yet and they're not wanting to. Then we move on to the contemplation stage. This is where the client is actively aware of wanting and not wanting to change. This is where they have the pros and cons of both and are asking, what can we really get out of this? This explores the client's barriers, and we really discover that the process of their thinking can really disrupt the process of them wanting to change. So this is where we use OARs. We use open-ended questions, affirmations, reflections, and summaries, and we really try and elicit that change talk that's inside of them. Preparation is the 3rd stage, so this is where they're actually preparing to commit and change their behaviors through some goal setting. Then we move on to the action stage, which is where if the preparation phase was successful, we take proper action in changing those behavioral patterns, which then leads to the maintenance of those behaviors, basically just meaning that there is long-term maintenance and making sure that those behaviors are stuck by consistently. Then there is relapse. Relapse is very normal and is actually crucial in the phases of change. It really allows them to renew the processes of the stages without feeling judged and without feeling overlooked. These stages really measure where the client is at in the moment, and it can allow for tailoring of those motivational strategies to kind of push that program to where they want it to go. Miller and Rolnick's Addiction to Medicine have a version of these stages to change, very similar to what we've discussed earlier. There's the willingness of the client actually wanting to change and the importance of that to them. There's the ability, so the self-confidence to change and how they think they're able to change, and the readiness if it is an immediate priority for them to change. So we must be able to match the stages of change in which the client is in. Statistically, more than half of Americans are not meeting the minimum requirement for exercise. That is 150 minutes of moderate intensity exercise per week and 2 days a week of muscle strengthening. So obesity is prevalent in almost 40% of adults, according to a survey done in 2017. So there are different reasons as to why people work out. This can be due to body image, this can be due to obesity, high blood pressure, which can lead to cardiovascular diseases. So motivational interviewing is also very efficacious in reducing anxiety and depression. However, we can't tell a client what to do. We need to resist the authority and the judgment that naturally comes above us so that they can facilitate their own autonomy and their own direction. There are some barriers in clients not proceeding with consistent exercise. This can involve the cost, the access to facilities, or even the client's psychological readiness. If we're not assessing their psychological readiness properly before we start, then the exercise plan won't empower them to make those long-term decisions. To understand where motivation can really go wrong, we talk about the spirit of motivational interviewing. This is the active collaboration between the client and the practitioner, where we share genuine curiosity regarding the client's perspective. Miller and Rolnick rolled out 3 different stages. There's collaborative, honoring, and evocative. The practitioner must develop a collaborative therapeutic relationship. This is where joint decision-making occurs, and the practitioner must acknowledge that the client knows the most about themselves. This is where internal motivation is elicited by us as the practitioner or the therapist. This can really explore unresolved ambivalence. This can weigh up the pros and cons of the decision, and if this is done unconfrontationally, then this ensures the client feels heard. The next stage is evocation. This is where the client activates their own wants and motivations for change. The practitioner really connects health goals, whether this be long-term and short-term, to what the client really cares about. So being a good father, for example. So the last stage is honoring client's autonomy. This is basically letting the client know that the choice is completely up to them, as we are only a guide for advice. So for example, I might get a client who is a heavy drinker, and so I might ask him the question, what are some goals you think you'd be able to achieve? We can really target the client's core motivation. We also need to respect the client in their decisions and their values and not judging them so that they actually are willing to change. Because the lack of motivation is actually causing the ambivalence, we're here to support the motivation that they choose to have. In doing this, we really connect to things the client cares about, maybe how being a heavy drinker can hinder him being a good father. So affirming the client can be applauding them of their good work and creating open awareness so that we can have two practical applications of motivational interviewing. One is building the motivation to change, and two is strengthening the motivation and commitment to change. Building motivation to change. This is establishing the therapeutic relationship using open-ended questions, affirmations, reflections, and summaries, also known as ORs. This leads the basic motivational interviewing skills, and this will establish the relationship in sync with the spirit of motivational interviewing. So for example, we could reflect and praise them. For example, we could say, so I heard you lost 10 pounds. That is an incredible achievement, and it really shows how well you're tracking on so far. And we can also paraphrase, so what I'm hearing is a good example for that, which can really emphasize the client's statements to explore their own motivations better. And then we can affirm and just really appreciate the client as to what they're doing. Now the second one is strengthening commitment to change. This basically involves goal setting, eliciting change talk, and just setting a plan of action. And this can be easily done by asking 4 questions. 1, disadvantages of the status quo. So what worries you about your blood pressure? This really allows the client to be honest about their concerns and what they want to see. And then the second one is advantages for change. How would you like your life to be different if you lost some weight? This really looks at the other side of things and activates the optimism instead of pessimism so that they're able to motivate themselves. Then there's the optimism for change, which is basically, when was the last time you made a significant change in your life? We get to unpack the advantages of them not drinking and the other achievements that they've made in their lives. Then there is the intention to change. So in what ways do you want your life to be different? We can then let them talk about what they want. This highlights the discrepancy between really where the patient is and where they want to be. We're able to reflect and summarize back onto them and to see really exactly where their goals are and ask them, where do you want to go from here? There are some guiding rules regarding motivational interviewing, and we follow the acronym of RULE. Resisting the writing reflex. Basically, we have a natural impulse to direct the client towards a specific path. However, people with an ambivalent mindset are usually quite resistant against persuasion. Then we have understanding the patient's own motivations. We want to explore the patients with our own curiosity, explore their motivations, and understand their barriers for change. Then we have listen with empathy. So being able to use those open-ended questions and affirmations, and basically just using the basic motivational skills, such as I understand or I see, so that they feel heard. And then we have empower the patient. So it really helps them to produce those self-management skills in supporting patients and their decisions, because collaboration is motivation, and that really supports their autonomy. There are some barriers of motivational interviewing. These can be time pressures or a patient really wanting a quick fix that we really can't offer to them. So we've got to remind them why they're here and what they really want for themselves. Motivational interviewing is something that should be widely explored to grow patients' awareness about themselves and just have a significant therapeutic tool under your belt when encountering a patient in ambivalence. Lastly, motivational interviewing does derive of communication skills, that be active and reflective listening, developing discrepancy for the patient, so seeing their current goals and their future goals, rolling with the resistance, so if a client feels like we are moving too quickly, to remind them that it is their choice to change. And so it allows us to be non-judgmental and just to roll with what they're wanting. And then supporting self-efficacy as well. Some people have tried to change their lives before and it has been unsuccessful. So we need to reflect and congratulate that client of what their successes and their strengths have been to really promote self-efficacy. Motivational interviewing can be tailored towards anyone. The practitioner just has to make the choice to listen.